As we begin our study of anatomy, there are a few common terms we need to become familiar with. Anatomical position is a body position that provides us with a common reference point. When you look at a map, you know that up is north and down is south because we have decided that that is how you read a map. We need to do the same thing for the human body. Anatomical position has the body standing erect, facing forward, arms at the side, and palms facing forward. So this is not a normal position, but by facing the palms forward, we give the hands a definite front and back. As we look at the body, we have certain names for certain regions of the body. Anything having to do with the head is cephalic. On the cheek, the term is buccal. When dentists talk about cavities, if the cavity is on the cheek side of your tooth, it's on the buccal surface of your tooth. The point of your shoulder is the acromial region. The axillary region is your armpit. It sounds better than armpit. The front part of the chest is the thoracic area. And right in the middle of the chest is the sternal area. The upper arm is the brachial area. Here in the elbow, this bend in your elbow is the antecubital area. In the Bible, it talks about cubits as a form of measure. A cubit was the length from the longest finger to the elbow. So the elbow would be the cubit, in front of it would be antecubital. Your wrist area is known as the carpal region. The bones of the wrist are the carpals. The front of your hand, where your palm is the palmar region. And if you can count on it, it's digital. So your fingers and your toes are both digital. The area of the stomach is the abdominal region. Your belly button and the area immediately around it is the umbilical region. Here on the side of your hips, where those bones are, you can feel your hip bones, that's the coxal region. The bend in your leg, right where your leg joins the body, is the inguinal region. And the area of your body in between those hip bones is the pelvic region. The pubic region is that lower area where the genitals are located. The upper leg or the thigh region is the femoral area. And the patellar area is the front of your knee, where your kneecap is. Your ankle are the tarsal region. Tarsals are the bones of the ankles. As we look at the back of the body, the back of the head is the occipital region. The neck is the cervical region. Right down the center of your back, where the vertebrae are, is the vertebral region. Where your shoulder blade is the scapular region. Behind the elbow, where your elbow bends, is the olecramal region. The lower back, where your back bows inward, is the lumbar region. Right at the very bottom of your back is the sacral region. And the fleshy part of the hips are the gluteal regions. The perineal region is a really hard one to show on a picture. It's the area between your legs. It's between the anal opening and the external genitalia. The popliteal area is behind the knee. The calcaneal area is your heel. The plantar area is your foot. Now you use these terms to describe things. For example, plantar warts are warts on the bottom of your foot. The popliteal artery would be behind your knee. We also have directional terms that we use. When we use the term anterior, it means the front. You're facing forward. Anterior can also be used to mean in front of. The ventral surface is the front or belly surface of anything. Posterior means the back or in back of, and dorsal is the back surface of something. So here you see an anterior view of the body. This would be the ventral surface. This is a posterior view of the body. This would be the dorsal surface. Additional directional terms include superior, which means above, and inferior, which means below, lateral, which means to the side, and medial, which means toward the middle. So if something is lateral, it's to the side. Lateral sounds a little bit like ladder, and you use a ladder to climb the side of a building. Medial would mean toward the middle, and medial sounds a little bit like middle. Superior would mean above, and inferior would mean below. So how do we use these terms? Well, the heart is right here in the middle, and the lungs are on either side. We could say the heart is medial to the lungs. It's between them. Or that the lungs are lateral to the heart because they're to the sides with reference to the heart. The thoracic region is superior to the abdominal region. The pubic region is inferior to the abdominal region. So that's how we use these words. We can also use the term superficial if something is on the surface and deep if something is beneath the surface. we talk about certain muscles being superficial muscles and other muscles being deep or deep to something else. On your arms and your legs or your extremities, we have to use some different terms. We use proximal if the area is closer to the point of origin of the arm or the leg, and distal if it's further from the point of origin of the arm or the leg. The point of origin for the arm is the shoulder, and for the leg is the hip. So as we look, we have distal if we're away from the shoulder or the hip, proximal if we're closer to the shoulder or the hip. We would use these terms to say things like the wrist is distal to the elbow. The knee is proximal to the ankle. Whenever we look at models or parts of the body, we frequently cut them up into pieces so that we can see the inside better. And we need to know what kind of a piece we're looking at. So we have different planes or sections. If we have a cut that divides a piece into top and bottom, we have a transverse plane or a transverse section. If we cut the piece into front and back regions, okay, so we're cutting down the middle, front to back. Then we're going to have a frontal plane, or sometimes it's called a coronal plane. And if we cut it into right and left pieces, then we have a sagittal plane. If we exactly cut it down the middle into right and left halves, then we have a mid-sagittal or a median plane. The body is hollow, so there are cavities in the body. The dorsal cavities are the hollow spaces on the back, and the ventral cavities are the hollow spaces on the front side of the body. The dorsal body cavity can be divided into two areas, the cranial cavity, which houses the brain, and the vertebral cavity, which houses the spinal cord. The ventral body cavity can also be divided up. We have a muscle called the diaphragm in the ventral body cavity. This will divide the body cavity into the upper region or the thoracic region where we'll have the lungs and the heart. The lower region is the abdominal and the pelvic region. This is sometimes referred to as the abdominopelvic cavity if we talk about the whole thing. Now everything below the diaphragm is the abdominopelvic cavity. There's no good division. There's not a muscle or a particular divider between the abdominal region and the pelvic region, but basically the pelvic region is any part of that ventral body cavity that's inside your hip bones. See where your hip bones come here? So any of this region is your pelvic region. In the abdominal cavity, you will have the stomach and the intestines and other digestive organs. In the pelvic cavity, you have the urinary bladder and any of the internal reproductive organs. Many times physicians or other medical professionals don't want to open you up to see what's inside, but they push around on the outside to see what's going on. When they do this on the abdominal pelvic cavity, they do this with the idea that they've divided this into 4 quadrants. Sort of the belly button is in the crosshairs. We name these quadrants the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. Now remember, you always have to be in anatomical position. So even though you're looking at this and it's your right side as you're looking at it, it's the person's left side. So you kind of have to turn yourself around and put yourself in the body to get the right and left correct. In the right upper quadrant, we have this large organ that's the liver, and this little green thing peeking out here is the gallbladder. So a lot of times pain or swelling in this region has something to do with the liver or the gallbladder. Over here in the left upper quadrant, you've got the stomach and a few intestines. There's also an organ called the spleen over here. So if they palpate over here, which means put pressure on it and touch, then they may be feeling stomach or they may be feeling the spleen. Here in the right lower quadrant, this little squiggly thing is the appendix. So a lot of times pain in the right lower quadrant is associated with appendicitis. In the left lower quadrant, you primarily have just intestines. So pain over here is usually something to do with gas in the intestines.